Mom, seriously, I'm trying to make a video. Can you give me 1 minute? Let's try this again. Hi, and welcome to the Spring Hill Equine Seminar. If you're new, like me, don't worry. It's gonna be fun. We'll give everyone a chance to grab some food and get comfy, and then we'll get started. Mom, I'm working here. You're always embarrassing me. Okay, I think we're about ready to go.
Hello, Facebook and YouTube land. We are coming in hot tonight with everything you ever wanted to know and didn't know you didn't know about equine teeth. But before we get started with that, let's talk a little bit about what we have going on here at the clinic. If you've been around at all in the last couple days, there is massive construction going on. So the front door no longer works. If you want to come in through the barn aisle, you can knock on the back door if you don't see anyone, but you should be able to see someone just as usual. We're in there, I promise. Just bear with us while we get through some construction. We also have wellness signups happening now, so don't miss out on the greatest Christmas present your horse ever asked for, and that's a sign up for our wellness program. So we have those going on. And I think that's about it. So without further ado, we're gonna get started talking about all you ever wanted to know about horse teeth.
Thanks, Dr. Letcher. Hey guys, I'm Dr. York. Like Dr. Letcher said, we're going to talk about teeth today, which are a very common thing you may see us for, but we often have misconceptions when it comes to teeth in horses too. So we're going to go into a little bit about what kind of teeth horses have, why they're special, why we do dentals, what happens in the normal stuff, and then what goes on when things go wrong too. So let's start by talking about what kind of teeth horses have. Now, interestingly, they're not the same kind of teeth that humans have, like dogs have, cats have. They're called hypsodont teeth, and hypsodont means long-crowned. So look different than the teeth you have. You can see in the picture here, on the left, here's an image of a cross-section of human teeth, and you probably found this familiar, nice shiny white teeth. And then your horse's smile here on the right side, and you may think, wow, he needs to brush more, they're very yellow. But actually, that's because they're a different type of teeth. We'll talk about that a little bit more on the next couple slides, but basically they're not covered in that same shiny white enamel that we have in human teeth. The enamel in horse teeth is on the inside. So they're different because they're evolved for different purposes. Horses evolved to chew coarse grasses, forages, grains, consistently for many, many, many years. Human teeth and dog and cat teeth evolved to be able to withstand the forces necessary to do the biting and to have those teeth last forever in the mouth, as opposed to what horses do. Horse teeth grind down over the years, and they constantly, you may think about horse teeth constantly growing. They don't grow, they erupt over a horse's lifetime, and we'll talk about that a little bit more. But basically, they're a different type of teeth, and they are for different purposes. So here is a horse tooth, and you're looking at one of the cheek teeth here. You're looking at the view from inside the mouth. So here's a non-painted picture here on the left, and then a painted picture here on the right. Now remember, the enamel on a human teeth is on the outside. That's why your teeth are white. That's why your dog's teeth are white, and your horse's teeth are not. The enamel is what makes it white, and the enamel is also the hardest part of a body. So even harder than bone is enamel. I'm gonna line out the enamel here on this unpainted picture, and it's the kind of whiter part here you can see, and on the painted picture you'll see it's in red. So this is the enamel, which on you is on the outside, on the horse it's on the inside of the tooth. They have two other types of material in the tooth, similar to the way you do but at different places. Dentin is on the inside that surrounds the pulp horns, the live part of the tooth, and then the cementum, shown here in green, is the yellowy, kind of softer material that's actually on the outside of your horse's teeth, and that's why they have that yellow look that human dog teeth don't. In cross-section here, you can see the hypsodont, or the horse tooth, on the left, and the brachydont, or the human or the dog tooth, on the right. Much shorter tooth in general is that brachydont tooth, like our tooth, and that tooth is meant to stay in for the whole life once you get your permanent teeth. On the other hand, the horse's tooth, very, very long, so only a little bit is exposed in the mouth. You can see here in this image, the visible crown is way up here. This is the only thing you can see inside the mouth. Then you have the crown, which is inside the jaws, inside the mandible or maxilla. And then the last little bit way at the top is the root. So as the horse grows, this is basically what he's born with when he develops his permanent tooth, which is inside of his head. So you're going to have this long, long, long tooth, and eventually that's going to progress towards the inside of the mouth as he wears away the part that's the visible crown on the top. So here's an image of that. So this is a picture from a young horse. Okay. So let's say this is a 4-year-old horse or something like that. He's got a very, very, very long tooth. You don't see much of it. It's up inside his skull. So on the upper jaw, you can actually see this is the sinus up here. Those teeth go almost all the way into the sinus. The roots of those teeth are in the sinus. So as that horse ages, that tooth is going to progress downwards as the occlusal surface, the part that he chews with, gets worn away. And eventually, when he's an old horse, he's going to have very little bit of that tooth left. So this is the way they are when they're young. An older horse would probably only have about that much left. They're designed to slowly wear away over a horse's life, and that's with the way they evolved on coarse forages, like I said, stuff out, when he's constantly grazing 24 hours a day on non-rich foods, so coarse foods, just grazing on the plains. And as that tooth is worn away, which we expect to be about 3 or 4 millimeters a year, the new tooth comes in. And horses evolve to have about 25 years worth of tooth left in their mouth that'll be able to progress inward. So about 25 years of tooth in the horse's mouth under ideal conditions. And we'll get into that in a little bit. This is under ideal conditions. So about 4 inches long there when they're starting. Now let's also take a tour of the horse's mouth. Oh, we have a question maybe?
We have a Facebook question.
Okay.
As the tooth is erupting, what fills the empty space?
Basically, it just turns into like bone. Oh, okay, sorry. So what fills the empty space when those teeth are erupting? As there's less tooth inside the head, what fills that empty space? Well, in the upper jaw, in the maxilla, you will have a wider sinus area, so there'll be less tooth up in the sinus, so you just have a wider open sinus, and then the rest of it's just going to be bone. Okay, so we have just the skeleton of the horse here, and we'll talk about these specific teeth, but let's start by just looking at them here. So the incisors you're probably familiar with. That's the part of a horse that's easiest for you to see. And then we'll talk about the canine teeth and the wolf teeth, because those get confused a lot. So canine teeth right behind the incisors, generally only in males. Occasionally you'll see them also in a few females. Wolf teeth, I've got some better pictures of them. We'll talk about those. And in between, though, there's your interdental space, and that's going to be where your bit sits. If you put a bit in your horse's mouth, it's going to sit right here. So that's why you can reach into your horse's mouth in an area and not feel any teeth in one area. Then we have premolars and we have molars, and those make up the cheek teeth. Premolars and molars look similar in the horse's mouth. There are baby teeth for premolars. There are not baby teeth for molars. And they come in at different times. And then up here you have the temporomandibular joint, or your TMJ. All right, so incisors, as you would imagine, generally used for grasping grass out of the ground and pulling the part we're most familiar with. They're quite sturdy, long-rooted, and we often find that they're not the problem in terms of like the abnormalities in your horse's mouth that would be commonly seen on dental issues. So if you have issues with the incisors, it's usually secondary to something else going on in the back of the horse's mouth, but we'll talk about that a little bit more later. Okay, so canines versus wolf teeth. These guys are confused a lot because they look different and they're kind of sharp and a little bit triangular. So canines are larger and they're up closer to the incisors. So if you open your horse's lips from the side, you'll see his canines behind his incisors. If he's a gelding or stallion, usually, like I said, occasionally in mares, but usually the boys. So the wolf teeth aren't very visible unless you really look inside your horse's mouth to the point that you can get right in front of their cheek teeth. So they're very small, generally very small, and right in front of the first cheek tooth here. Technically they're premolars, but they're very differently shaped than the rest of the premolars. Your horse may have 1, 2, 3, or 4 of them. More often they're seen on the upper jaw, less often on the lower jaw. And historically they've been removed frequently when a horse is castrated, for example, or just when he's a year or so old. It's done less consistently nowadays. I don't routinely pull wolf teeth unless they're lower wolf teeth or they're causing a problem, the horse is sore on them, or they're blind, meaning they're not, they don't come through the mucosa there. So don't always pull wolf teeth anymore. They cause problems less than people thought, but certainly if they are causing a problem or if people would like them to be pulled, we do offer that. So the cheek teeth, you can see here on the cross section again, we got 3 premolars, 3 molars, and in an intraoral view of the horse's mouth, you can see they almost just look like one solid pack of tooth on both sides. So we have 4 arcades, upper right, upper left, and then lower right and left. We number those, the 100 arcade, the 200 arcade, so we know what tooth we're talking about. So if we're looking into this horse's mouth here, this is the 100 arcade. I've got, you know, the list of 106, 107, 108. So if I need to refer to a certain tooth, that's how I do it. But yeah, so this is a lot of what you'll see when you're actually doing a dental. You need to have a nice light in there and be able to really get a good view in order to know what's going on inside your horse's mouth. So how does a horse chew? One of the important things to know about how the mouth is designed is that the upper jaws are a little bit outside of the lower jaws. So take a look at this picture. You can see this is the upper jaw here, and they sit just a little bit outside of the lower one. And that makes a difference because it affects how the teeth are worn. So usually when horses develop sharp little points, which is a very common thing, every time we do a routine yearly dental, we take down some sharp little points. They're going to develop on the outside edge of the upper teeth and the inside edge of the lower teeth because they're sitting just a little bit offset when the horse chews. So a horse moves his jaw in an elliptical pattern. So the lower jaw drops down and then moves over either right or left, depending on what the horse is doing or his preference, and then comes up into contact with the upper teeth again and then grinds back across. And a little bit of front and back component, but that's generally, it's more of like an up and down component when he chews. And then that's based on him having teeth that slide well over each other. Okay, so if there's one really long tooth that gets in the way, he can't do that elliptical up and down motion, and it's going to really affect how he's able to move his jaw. The amount of the amount of wear a horse gets or what type of wear he gets is going to be determined by several things. If he has any dental abnormalities or ongoing dental health issues that make him unable to move his mouth in a normal way, just his own conformation, the kind of food he eats, if he eats a lot of grain versus a lot of forages or grazing, and then just his own habits, whether he tends to want to chew with the right side or the left side of his jaw. So why do we do routine dental care? The question we get asked a lot is, what about wild horses? Why don't the wild horses get dentals out there, you know, the Mustangs living in the American West? Well, there's several reasons. One of the important things is that the average lifespan of the wild horse is up to like 15 years. So we generally want our horses to live long, happy lives into their late 20s, early 30s. Our goal is no longer 15 years for a lifespan for our horses. So, you know, we want to do extra things so we can keep them happy and living longer. And then we talked before about ideal circumstances. Under ideal circumstances, there's 25 years of tooth in the horse's mouth. Now, rarely does that actually happen, though, because it relies on a couple of different things. Number one, reproduction under natural selection, meaning you have a bunch of wild horses. If a horse is born with really bad teeth, his teeth are getting infected, falling out, fracturing, creating sharp points, he's not going to be very viable in the wild. So he's not going to thrive, he's not going to gain weight, he's not going to be able to feed himself, breed, make more of him. So in a wild situation, that horse with poor dental health wouldn't succeed and go and make more of him. However, in captivity, we don't breed for dental health. We breed for speed or jumping or conformation or whatever else, but we're not saying, oh, that's a beautiful teeth in that stallion, we should make him our herd sire. So, and then also, few horses in captivity have the exact kind of diet that the horses evolved on. So even if your horse is grazing, it doesn't mean he has the exact type of forage, coarse forage, the wild grains, the bark, the little bits of things that horses are eating 24 hours a day slowly. We feed our horses grain, we feed them hay. They're abnormal diets, they do well for what we do with our horses, but they're not the ideal for dental health. And then also we ride our horses. We communicate with them through a bit. We ask them to come up into a frame and use their head and neck in a way that they might not choose to in the wild. So we ask more of our horses' mouths in terms of communication and riding than they would have to in the wild. And then also just comfort. We love our horses. We want them to be happy. Horses are basically eating machines. So they are going to eat and eat and eat until there's basically no way they can do it anymore. So if they have severe pain or teeth that really restrict them from being able to move, you might start seeing signs. But until you see those major issues, that horse may eat and not show you anything, despite the fact that there are things going wrong in his mouth. Okay, so signs of dental problems. Now, the most important thing, and I put it in yellow here because this is what I want you guys to understand, horses may not show signs. The time to think about his dental health is not when he's showing signs, okay? Because like we said in the last slide, that may not be till things are really, really bad in there. So we don't want to wait for signs like the list I'm going to give you before we check the teeth, but these are signs that more significant stuff is going on. So dropping food is the most common one people will see first of these things. Difficulty chewing, kind of turning their head when they chew, doing strange things. Excessive salivation, drooling when they eat. Losing weight, of course. And then if you look at the horse's manure, if he's not able to chew up his food well, you may see a lot of stemmy bits of hay in the manure. So it doesn't look like nice, shiny, green, brown manure. It looks like there's actually pieces of hay or pieces of grain in there, and you shouldn't see that if the horse is digesting well and chewing his food up as part of that. Head tilting or tossing when he has the bridle in, fighting the bit, resisting the bit, having trouble stopping and turning, and kind of set his jaw, not come back too easily. Bucking can even be a sign of a dental issue. Some horses that have pain don't know what to do to explain that to you, so bucking is just how they may express that frustration. Foul odor from the nose or the mouth can indicate infection. Nasal discharge. Remember I said the teeth on the upper jaw are very intimately related to the sinuses. The sinuses drain out the nose, so if you have infection in the tip of a tooth in one of the cheek teeth, that's going to go up into the sinuses, fill that up with pus, and then it's going to drain out the nose, and that's gross. And then swelling of the face, jaw, or mouth. Anything abnormal you see, any trace of blood coming out of the mouth. Those are all big bad things. Don't wait till you see those things. You're going to have your horse looked at way, way, way before you start to see these abnormalities. So prevention is the key to equine dental health. If I could have you remember nothing else from this lecture, that's going to be the thing. Prevention, prevention, prevention. It's cheap, it's easy. We can do a lot when there's not major issues. Young horses, minor things going on, very quick and easy to correct usually. If we wait till they're having problems in middle age, or certainly till they're having major problems when they're older, there's sometimes just not much we can do. If your horse has teeth like in this image, we can't put them back. So we can do our best with what we have. We can make your horse a little bit more comfortable, but we certainly can't give him functional teeth back if he has major issues. So don't wait till then. It's going to be harder, it's going to be more expensive, and there may be just things we can't do. All right, so the dental float, you're probably familiar with that term. That's the basic dental exam and the yearly dental work we do to smooth things out in the horse's mouth. There's other more complicated parts of it if there's more abnormalities, but the basic, the float, means from the carpentry industry to just level the teeth out. Now, a lot of what we do is take down the little sharp enamel points that, that occur on the outside edges of the upper teeth and inside edges of the lower teeth because of that offset that the horse's jaw has. You know, we look for other issues too. We look for little ulcers going on, any dental abnormalities, and we'll look for things that need to be corrected above and beyond those little sharp points. What that does is help your horse chew better, digest better, make better use of the feed that you're paying to give him, prevent GI issues. If your horse can't chew his food up well, it may be predisposing him to things like choke or even colic. You know, if there's non-well digested food, it can cause colics in some situations. Your horse will be happier, more comfortable under saddle, have teeth that last longer. Just the small things can help the teeth not have bigger issues later on. And then look for other bigger issues that may be there but not declaring themselves yet, like periodontal disease or fractures. Just the other day, I had a routine float on a horse, and lo and behold, there was a big old fracture in the mouth that wasn't showing itself on the outside. So very good idea to take care of your horse's teeth preventatively. And how often? It depends on your horse's age, and it depends what he does, and it depends if he's got other stuff going on. So young horses generally, there's a flurry of activity going on in a horse's mouth when they're below 5 years old. So they're shedding, over those first few years, they're shedding 12 incisors, they're shedding 12 cheek teeth, and they're erupting over 36 to 44 teeth that they're going to keep permanently when they're mature horses. So there's a lot going on. We want to make sure all that is going right, because if you catch it early, it's easy to take care of. So there's often sharp teeth, actually surprisingly sharp teeth in a young horse, even though you think there's not, you know, he hasn't had a lot of time to cause problems. They're often sharp, and remember, that's when you're going to be starting your training usually. So you don't want a horse that's just starting his training, you're building that trust, and then he also has to deal with sharp, uncomfortable things when you're trying to explain to him that you can communicate through that bridle that you're just teaching him to use. So we want to make sure all those teeth are coming in normally, nothing's got stuck on each other and what we call maloccluded when they're developing and coming in. We want to make sure there's no sharp points. All the caps that are supposed to come out have come out, and nothing is prevented from coming out. So we say every 6 months for a young horse while that mouth is immature and there's a lot going on. And so this is just a picture of a cap, the deciduous tooth that's come out, and here's a picture of a retained incisor tooth that hasn't come out appropriately.
Question.
Got a question?
We have one real quick. Can you tell Sharon that if she waits, she'll find out what causes her fracture in cheek teeth?
Okay. Sharon, if you hang on a few minutes, Dr. Latcher is going to talk to you about what causes a fracture in cheek teeth. That's a really good question. Okay.
And then we have another question about bidding young horses.
Mm-hmm.
What is an appropriate age to start bidding up a horse? I heard they shouldn't start bidding until 5 years old. Basically, can bidding too early cause damage later on?
I don't think putting a bit in a horse's mouth to get them used to it at a younger age is going to do anything bad. It would, for me, be more about the overall physical maturity of the horse, and is he ready to start being ridden? Because he can have a bit in his mouth and you get him used to that without really pulling and pushing hard on the mouth at all. So just having the bit in there isn't going to do anything. It's a matter of what you're doing with the bit. So if he's old enough to be ridden, how old that is depends a little bit on what breed you're talking about. Usually by 5 they're well under saddle. But again, it depends what part of the industry you're coming from. I think anything you do with a young horse, you're going to do very gently and very carefully. So the bit itself, I don't think should cause any issues. Okay. So going on to the mature horse, and I call this over 5, 6 years old because all of the permanent teeth have come in by that point. So then if you've taken care of your horse's mouth well when he was young, he doesn't have any issues that he's coming into his mature years with, he should be able to just be on a maintenance regimen to prevent things from coming back. from coming up, and to prevent little points and things like that that would disrupt your communication. So annual, every 12 months or so for the average horse. It depends a little bit. If we're checking your horse every year and we find there's kind of a lot going on by the end of that year, you might want to shorten that up. It depends a little bit on the horse. Some horses are more sensitive and develop little sharp points faster, develop little ulcers faster. Of my 3 horses, I do one of them a little bit short of a year because she tends to be sensitive and she tends to develop more issues. So you just know your horse, but at least once a year is a good way to manage that. Horses in demanding competition, you're really asking a lot of them, and you want to make sure nothing's going on with their mouth. You may want to plan on that a little bit more frequently, at least to make sure you don't run into anything. Certainly if he's got pre-existing abnormalities. So if you've had to correct a lot the last time you did a float, you may not want to wait a full year before the next one to make sure that you don't get back to where you were. So if you want to keep making sure that you've kept things in line before you get back to the maintenance schedule. And then if your horse has ever lost a tooth or had a tooth extracted, remember he doesn't have one to grind against to wear that other tooth away. So that tooth is going to continue growing unimpeded. So that's a big deal. If your horse ever had a tooth that's extracted, you need to be on an every 6-month schedule to make sure the other tooth that wasn't extracted, that was opposed to it, doesn't overgrow. Okay. So our seniors, this is where I hear a lot of misconceptions, because there's some people that think, oh, when your horse is a senior, he doesn't need dentals anymore. This is really, really, really important to fix the misunderstanding. You do have to be careful when you do dentals on older horses. You don't want to be aggressive. You can't take a lot of tooth because they have limited tooth left in their mouth, and you have to protect it. If your horse has had good dental care up to his senior years, he's probably in fairly good shape. They can get to the point where they start to wear away the useful surface they have, but if he's not had good dental care, you may have major issues in there by this point. So hopefully you've taken care of your horse before he gets to the senior years. But when we go in there and we see major issues in the mouth on a senior, it's a little tricky because you have to make the horse more comfortable. You have to take away the sharp things that are hurting him, but you can't be aggressive and take a lot of tooth because they only have so much left. So we're going to go in there and just take off anything that's going to bother the horse, help him chew easier, check for anything that's loose or displaced that may, or disease, excuse me, that may have to come out for the horse's comfort. Any teeth that have previously been lost or extracted, we have to make sure the other one on the other, like if you had an upper tooth, make sure the lower tooth doesn't overgrow. And so every 6 months to 12 months, depending on your horse's age, definitely don't listen to anyone who says senior horses don't need dentals, though. You just need careful dentals. All right, one other misconception I want to go over. Some people still have a fear of the mechanized floats or power floats, thinking they're very aggressive and scary, and it really couldn't be further from the truth if used appropriately. So the hand floats, you can see in the image here, are kind of like a farrier's rasp, where they have sharp teeth, and I've got one here with me. I still occasionally use these. They live in my truck. They don't come out as much as they did in the beginning of my career, but basically it's like a little farrier's rasp, and if you pull it across the teeth, it'll take tooth. The power float has a little drill that is attached to it, and then it's a carbide blade that spins, and if I put this on the tooth, it's going to rotate and then take down tooth. So people have a misconception that these are really aggressive and dangerous, and sometimes don't want to do power floats on their horses because they seem scary and they make a loud noise. I find that these are actually much more gentle. If I use a hand float versus use a power float, I'm much less likely to nick anything accidentally, like the mucosa, with my power float than I am with my hand float. So I wanted to show you guys one thing. I'm just going to turn this on. It's going to get loud for a minute, but I've got my finger right on the power float, okay? Okay, so I can keep my hand right on that power float and it doesn't cut me. So it's very, very soft and gentle on the soft tissues of the mouth, the tongue, the mucosa, but it will take down tooth if I put it on top of tooth. So as opposed to my hand float, which anything I put it on, it's gonna tear. You know, and ideally that's tooth, but it is sharp, so you have to be careful with what you're doing in a horse's mouth with it. So the moral of that story is don't be scared of the power floats. They make a noise, but unless you use it inappropriately, which we do not, I like them a lot better. They're a lot faster for the horse, less sedation, less time, and having the dental, less stress for him, and then it just does a really nice job. Okay, so let's see. I have a video here, but it's saying it cannot be loaded. Do we? We're going to quickly see if we can load the video. It's a demonstration of a float from the beginning to the end, just so you can see the whole process, but that may not happen, so I'll describe it if it doesn't work.
There is a question about a parrot mouth while we're waiting.
Okay.
Fill some space. What
Sure.
is a parrot mouth?
So a parrot mouth, all right, let me be the horse's head here. So if you think about, this is the upper jaw and this is the lower jaw, and his incisors should meet perfectly, right? So our upper and our lower teeth, just like them, should meet one on top of the other. When you have a parrot mouth, it's when you have a relative shortening of the mandible compared to the maxilla. So you would have your teeth overhang a little bit. And they can be really subtle, just a millimeter or two, and they can be very pronounced where the upper and the lower incisors don't meet at all. It's a congenital abnormality. They're born with it. It may be genetic. You know, if you have a mare with a parrot mouth, you can have a baby more predisposed to having a parrot mouth. More minor ones don't do a lot against the horse. If you have a very severe one, it can affect the way his teeth grow, not just on the incisors that you can see, but also in the back of the mouth. So if I have my cheek teeth back here, not just the incisors may be further forward, but the cheek teeth may be further forward. And that front cheek tooth can actually grow a sharp point because it's not well lined up with the bottom cheek teeth, you know, back in the horse's mouth. So there's only so much we can ever tell from looking at the horse's incisors, you know, just the way we can look at his face when we're grooming him, pulling his lips open. But there's a lot that we can see about what goes on in the back of a horse's mouth that we'd never ever get a chance to if we didn't have sedation and a speculum on the horse's head and a light up in there to get a really good look in the back of the horse's mouth. The old-fashioned way years ago of doing dentals was to just put a hand float up in the horse's mouth without a speculum on and just kind of do this and call it good. And you may be able to get the first couple cheek teeth smoothed down with that technique, but you'll never be able to actually get the back of the mouth taken care of. And so when I float a horse that's had that sort of float done, I usually find a ton of problems in the back of the mouth because that's where all the issues are.
So with a parrot mouth, would you also wind up with one tooth at the back if it's extreme?
Yeah, you can, exactly. So you can have the top arcade, it would be the front tooth that would generally have a hook going down, but because the lower arcade might be set a little back, and this can happen whether or not you have a parrot mouth, I do find these hooks a lot, you may find a sharp enamel point that's going up at the back. So if you think about it, when you have a hook in the front and a hook in the back, which, like I said, can be on any horse, not just the parrot mouths, when the horse is asked to bring his head into a frame, like a collection, like going on the bit, do that yourself and you'll notice that your lower and upper jaw slide a little bit, like that, when you go to make that position, pretend you're the horse. When they have those sharp points that are hanging down or hanging up, that horse physically can't move his jaws to slide on themselves to do that position. So that's one of the things I especially want to look for in a competition horse, really any horse, but a horse in competition who's asked to go into a frame. I want to make sure that he can do that little bit of forward or back motion with those jaws to get into that collected or get into that frame.
Don't mind me, I'm not here.
All right. We're working on the video.
It's here, just give me a second.
Okay, sounds good.
Sarah's saying that her horse has a pretty severe parent mouth, but so far no signs of issues.
Okay. It's the sort of thing where your horse may live a very normal life, may be able to do all the things you want to do. I would make sure you stay on that at least yearly dental with that horse. It's correcting the things going on in the back of the mouth. There may also be some degree of floating of the incisors that your vet may want to do if they tend to overgrow themselves. In a routine float, we don't usually do a lot with the incisors. Most of the work is in the back of the mouth and the cheek teeth because that's where a lot of the primary problems occur. And you can secondarily see stuff going on with the incisors. You may see slants or smiles of the teeth. All right, we got a video. But it's always the back of the mouth you want to address first. And especially in a parrot mouth, I would make sure you're looking at that, even if the front of the horse's mouth looks good. All right, so we've got a video here, and this is just a little routine dental I did the other day. We just videoed it so you could see the parts. So we're going to start by sedating this horse. I want this to be a comfortable and non-stressful experience for the horse, so we do enough sedation. They don't lie down, but they're sleepy. They're standing on their feet, just enough that they're not worried about it, and they'll let me comfortably put that speculum on. So I've rinsed the horse's mouth out at this point, a little mouthwash to get things clean, and then we're going to put the speculum on. Like we said before, you'll never be able to really know what's going on in the back of the horse's mouth unless you can use the speculum and take a good look back in there with the light. So we're opening the horse's mouth up a little bit. And then we're going to be placing her in our dental halter, and we usually will either have our technician hold the horse's head up, or we'll hang that over a rafter or so. So we're taking a look in the horse's mouth, taking a tour to see what's going on. So I've got a bright light in there. You don't get as much benefit as I usually get with the light because I'm also trying to video here, so it's a little trickier. But you can imagine, see how deep and dark that hole is. If I didn't have the light, I would never be able to tell what's going on in the back of the horse's mouth. So, so certainly we get a much better look in this way. So this is a routine float for this horse. She really didn't have a lot going on. Her lower teeth had a little bit of a ramp on the very front that I took down, but otherwise it was a pretty routine float. So you can see the power float is going on the outside edges of the upper teeth here. So I'm sliding that between the cheeks and the upper teeth, and that's just a little bit of dust that you see from the teeth. The horse's mouth is not smoking or on fire, but that's what the dust is. Just smoothing off those enamel points. All right, and when we're all done, we'll take a look, make sure, I'll put my hand in and feel and make sure there's nothing sharp there anymore. We'll give her another rinse, make sure we're happy with what we got, rinse her mouth out, and take her out of the speculum. All right. So, whoops. There we go. So at this point, that's all I have on the basics of teeth anatomy and the routine stuff we do. Dr. Letcher is going to talk to you about some of the more exciting stuff when things go wrong.
Like why cheek teeth fracture. Because it's so fun when they fracture their teeth. We open up a perfectly normal horse that you guys have had no issues with, and now we've got a fractured molar going on. And why does that happen? So we have a variety of things that can go wrong. These are just some of the images of how teeth go horribly wrong. And I have to say that one of the things that impresses me about horses that is very different between horses and humans is that there can be a pretty massive infection going on. There can be fractures. There can be all kinds of stuff going on in there, and they may never tell you. I don't know about you guys, but when my teeth hurt, the entire world knows my teeth hurt because I'm happy to tell them that my teeth hurt at every opportunity. So don't trust your horse when they're telling you that everything is fine. You can't get a good look, just like Dr. York just showed you in that deep, dark black hole there. So that's one of the reasons routine dental care is super important. So we're basically going to break down categories and break down things that go wrong into two categories. And one is developmental, or they were born wrong. And two is that they develop problems as they age. So in this first one here, on these incisors over here, we have too many incisors. So we have a baby tooth right here, and we have an adult tooth trying to come in right here. This is one of the big reasons that we need to look at young horses. These baby teeth are going to cause these adult teeth to come in incorrectly. And once they come in incorrectly, we have a limited number of choices for things we can do to correct them. And so we're going to be stuck with crooked incisors for the rest of that horse's life. Versus if we recognize that those baby teeth need to come out soon, we take them out, everything shifts around to where it's supposed to be, and off they go. It's like it never happened. One of the other things that can happen is it might not be readily apparent to you guys what's wrong with this picture, but one of the things is that in the arcade of a horse, there should be 6 teeth. So there's 1, 2, 3, 4, 5, 6, 7 teeth. We call that a supernumerary tooth, and this horse was born with 1 tooth too many. Just like in humans who have big wisdom teeth that will eventually crowd everything else, supernumerary teeth very, very, very often cause problems for horses. And so we need to recognize that we have that problem going on and determine a plan for what we're going to do about it. The other thing that happens with young horses as a developmental abnormality is, for example, we talked about parrot mouth just now while I was doing some IT work in the background there, but we can have conformational issues. The most common in horses is what we call parrot mouth. The other option is sow mouth, and that's where the lower jaw comes too far forward. The problem that happens there, and I believe Dr. York covered it, but it often means that the cheek teeth don't line up correctly. And so those horses are going to need some care for the rest of their lives. Noticing that at a young age and trying to set them up for success, we can make some minor changes to the incisors. Sometimes we can do bite plates. Braces are sort of an option. If you use the Google, you may find them out there, but they're not a great option unless you have really, really, really highly trained people helping you manage that process. The more common thing that we have is also a malformation of the tooth. So this is an adult tooth, but it's growing in underneath a baby tooth. This should come straight down, and it's not. It's got this curve here. So that is something else that we need to recognize and determine what we're going to do about it. And it's not a straightforward, we're going to see what happens, we're going to wait, we're going to take the tooth out now. There's a different answer for every single one of these based on your horse, how they're tolerating it, what the malformation is, all of these different questions that we need to answer before we can make a plan for what to do with it. Next, we're going to move on to sort of the young age horse. This is a very, very, very common problem from our standpoint. You as a horse owner may never see it, but from our standpoint, we see probably 3 to 4 of these a year, and it is what we call an apical tooth root abscess in a young horse. So this horse that you see in these pictures is 3 years old. So she's just starting to get those baby teeth erupting, as this will be her second premolar back. And if you look on this x-ray, you'll see that right there, there's actually a hole in what should be the lower jaw. And that's because, oops, pay no attention to that. That's because this right here is all filled with pus because she's gotten an infection. And the way that we knew this was happening is on her from the side, you could see a swelling. And then if you looked underneath her jaw, you could see a swelling. Here's the really annoying part about this. This popped up in a matter of days. You know, this horse was very normal. On Friday, she had a little swelling. We came out like Monday, Tuesday, the following week. And it always amazes me how quickly this happens. I think if you are running your hands down the jaws really critically on a regular basis, we may pick these up a little sooner, but it often amazes me how quickly they blow up. And you might be asking, how do they get this? And our best answer is that it's through the bloodstream. When we have those adult teeth forming like this one is, the blood flow around the bottom of the tooth, it slows down. It's really turbulent. There's a lot of stuff going on there. And so if there's bacteria in the bloodstream, it can settle out in that slow flow area. Just like if you're looking at the Swanee River, if you got a slow spot, things will settle out. Same with the base of a tooth. And we always have some level of bacteria running around our bloodstream, believe it or not. We've got white blood cells and an immune system to handle that, but sometimes it takes advantage of a situation, and this is what happens. So the question is, what do we do? Here's the bad news. The only real fix we have is to extract this tooth. And that means that for the rest of this horse's life, they are going to need to be on an every 6 to 8 month dental schedule, and they're going to need to have great dental care to make sure that that opposing tooth doesn't cause big problems. We will sometimes try these horses on antibiotics before we extract the tooth, but the reality is that I would say probably 90 to 95% of them, we end up having to take the tooth out. We just don't have any other option. Next, let's talk about normal things that go wrong in grown-up horses. Excess points can cause, if you guys look back here, this is ulceration on the cheek, secondary to just too many points being in there. Those enamel points that Dr. York talked about floating off. The other thing that this line drawing is an illustration of is something that we call excess transverse ridges. And then the picture over here shows it. And what this looks like is a really bad dirt road that needs to be graded horrifically, and it's washboardy. And both of these are relatively normal ways that the tooth erupts and grows. But if we don't manage kind of what the tooth is doing, these can cause problems for us from a riding standpoint. For one, you can see that the points were causing ulcerations on the cheek, but also when we have a bridle on and we have a bit touching the side, or even a hackamore, because I've heard I don't ride in a bit, my horse's teeth are fine. But even with any pressure on the side, hackamore, halter, no matter what you ride in, you're going to be asking sooner or later for something from the side, and you're going to create pressure on those points. The other thing that happens with the excess transverse ridges is, if you notice in the line drawing, and then I'll demonstrate it here, but those things line up like this. And so the teeth ratchet against each other and they can't move. Well, one of the things that we as riders do is ask our horses' heads to move. No matter what discipline you're doing, dressage horses, you're asking them to come onto the bridle. But many of our disciplines, we ask them to do some sort of collection and head carriage. We ask them to turn side to side if we're barrel racing quickly. If you shut your jaw and turn your head, look up and down, you'll notice that your lower jaw moves in relation to your upper jaw. And if these things are happening, then your horse can't do that. And so you get what we call resistance, and none of us want that when we're riding. And your horse is confused as to why you're asking them to do this thing they physically can't do. Give them a second, they'll open their mouth, reset it. But if we just do a routine float on these horses, we can catch this problem and not have it be an issue. Let's go into some other things that go wrong from a lack of routine floating. So here we're just going to go through these pictures real quick and then I'll talk about them a bit. So we've got an over-tall tooth right here. This would be an example of what happens in that horse who did lose a tooth. In this middle picture, one of the most common things we see right here, you see there's grass packed in between these two teeth. That's called a diastema. And then over here on this side, we have how our fancy term is a rostral hook, and that's just a hook on a front tooth. So the rostral hook and the over-tall tooth, you can figure out how those happen. The jaw doesn't line up in that rostral hook horse. He's got nothing opposing over here, and we get a giant hook. But you see that hook there, and it didn't come up last night. That hook developed over probably 2 to 3 years. Now, it didn't happen over 6 months, but it didn't happen over 5 to 10 years either. So this horse has not had routine care for probably 2 to 3 years. If this horse continues to not have routine care, that hook will grow down into the lower jaw. And in the meantime, this horse is not able to do that circular chewing motion that Dr. York talked about. So massive big deal. The overtall tooth, we've got a tooth that was missing opposite it for whatever reason, and this horse didn't receive that regular dental care, and so that tooth is now growing down. The problem with both of those issues is that we can't fix these issues in one foul swoop. We have a limited amount of tooth that we can take off before we open the root. It would be like going to the dentist and having them chop off the top of your tooth. They're gonna get into a root, and that's gonna hurt. It's also gonna kill the tooth. But we have to let the tooth tell us, where can we go? How much of this can we take off? But chances are good both of these are gonna take us 2 to 3 visits in 3 to 4 month increments to try to get them fully corrected. And then they are going to be a lifetime of maintenance. Diastemas occur for a couple of different reasons, but one of the reasons they occur is that overtall tooth in that one picture is doing this. So as it's growing down, it's pushing the teeth below it apart, and it's creating an opening, which our fancy term is diastema, that is then packing food, grass, you name it. There's all kind of schmutz that gets in there. And let me tell you, that stuff reeks. It smells so bad. But it can also happen on our older horses, and it's a very common problem that we experience with our older horses. For those overtall teeth, like I said, we're going to just simply get them onto a routine floating schedule. For the diastemas, what we're going to do is we're going to open it. We're actually going to make it bigger. First, we're going to try to correct the problem that's going on. So if we have any dental abnormalities that we can correct, like that overtall tooth, we're going to take care of that. So we stop pushing the teeth apart. And then we're actually going to make the hole wider. One of the things that happens is, you can see on this one here, we have grass and hay packed in. So we can either seal that, or we can make it bigger so that it's easier for stuff to come in and out of, or we can make it bigger and then seal it, because it's really hard to seal these really small diastema. So what we do is, you can see this tooth right here, we've gone in with a special burr that goes on our float, so it just attaches to the end of this, and it basically goes between the two teeth and makes the hole wider. For some horses, this is all we need to do. If we've got a lot of infection or unhappy tissues in there, the next thing we're going to do is, you can see on this image, this has been filled with some dental impression material so that we can allow everything under there to heal, quiet down, and then our goal is that if we've taken the problem away, we can get the teeth to come back together. So the question is a 3-year-old that has pocketing going on around this same tooth that we have in the picture here. On a 3-year-old, one of the reasons you'll see that is that because you have them losing baby teeth, you can have some kind of temporary openings in that area while things are kind of settling out. If you continue to see it, or if at more than 2 consecutive visits there's still a space there, I would strongly recommend radiographs, because it may be that you have a bit of an abnormality in how the teeth are coming in, and that is something that should be aggressively addressed on a young horse for sure. So if it's been there for longer than a year, like you've had those 2 6-month visits, it's still there, I would definitely recommend radiographs. And again, for those other horses, we're just going to set them up on a calendar where we're doing them way more frequently. And sometimes, unfortunately, it is going to take us a year to a year and a half of seeing them every 3 to 4 months to correct some of these major abnormalities. That's why you should get your teeth done early and often. So now let's talk about those fractured teeth. This is most commonly an issue in older horses. And one of the reasons it happens in older horses has to do with how their teeth age. So going back to the beginning of Dr. York's lecture, there's a section in the tooth called the infundibulum that is the center of it. As those teeth age, the infundibulum runs out, basically. And as it's getting close to the end, it will often develop cavities. Now, there are a few people in the country that can fill cavities, but there aren't many. They're few and far between. And the question is often, is it efficacious? And we don't know, honestly. We don't have enough papers to tell us that filling these cavities works. So as they get to the bottom of that and those cavities occur, we'll be putting forces on the teeth that they can't handle, and they will then fracture. In older horses, we can develop open tooth root canals, and that's what this middle picture is showing. There's actually a tooth root right there, and there is a probe going into it about ½ inch. So that's you or I having a pretty significant cavity. When that happens, it can lead to infection up in the tooth, and then the tooth can't handle the forces that are put on it from chewing, and it breaks apart, just as you see here. And sometimes this process can be incredibly insidious. We won't necessarily know that it's going on until we've seen a fracture, and that sounds crazy, but I'll have some suspicions sometimes. I go in and I look around a tooth, I'll see that maybe there's a questionable area, and we radiograph that tooth, and we've got an infection that isn't presenting itself as well as you would expect. And those teeth are the ones that will go on to do these types of fractures without any symptoms that we see until the tooth fractures. So again, we have a limited number of fixes for these, and it's that we extract the tooth. The tricky part is that this illustration makes it look like we just go in and we grab it and we pull it out. The saying, it's like pulling teeth, the most accurate saying in the history of sayings ever. Pulling horse teeth is a job. And for many of these fractured teeth, it requires specialized equipment. And we have one of the highest certifications of dentistry and veterinary medicine. We have someone who comes to the area once a quarter and helps us do those teeth, because it can be extremely difficult to get them out. But regular dental care, our goal is to identify those teeth and not have them get to that point where we're having to do the specialized extraction technique. And our favorite around here, incisors. These horses all have something called EOTRH. There's going to be a quiz for what that stands for later. It's equine odontoclastic tooth resorption hypercementosis. It's just like supercalifragilisticexpialidocious. It's along the same lines. And it is, we think it's an autoimmune disease. There's a similar disease in cats and humans. And in cats and humans, it doesn't have a treatment either. So spoiler alert, we don't have a treatment for it in horses. Almost every horse we see with it is over 15 years old, and many of them are over 20 before we start to see symptoms. But it is, like I said, an immune attack of the tooth structure. And so these horses start to get either tooth resorption, that's why the TR is in EOTRH, and that is the body attacking the tooth and resorbing it, or they get what we call hypercementosis, which is the cementum that's on the outside of the tooth that Dr. York talked about in the beginning, goes a little crazy. It gets, it just goes insane. Or, even more common, we have a combination of the two together. So we have the body simultaneously attacking the tooth while putting down more cementum. And so we get many different appearances depending on where we are in the process. But very early, this will be what we see, where you just see the outlines of the incisors very clearly on this mouth here. And you see a tiny bit of reddening up at the top of the gum. If you were looking at it in person, you would probably see that there were little tiny pimples, basically, there as well. And that is just micro abscesses that form. And then it can go on to be, you know, various versions of that where you see, like, we see way too much tooth here, and that is resorption of the bone over the tooth. And then we've got opened up areas of infection above. Over here, this tooth is fractured due to the process going on. This guy came in the other day for us to work on him, and he had lost these two teeth right here. He's got a little tiny bit there, but we got rid of all that. And then you can see that he just has a very kind of bulbous appearance. And finally, over here on the right side, you can see we have a bunch of tartar, we have some open kind of sores on the gum, and there's just, the gingiva is really rough, and it's kind of pushed out more than it should be. So, what do we do about this? The very first thing we do is we shoot radiographs. And you can see on here, I'm keeping Justin busy over there on the switcher, but this is a normal radiograph of front teeth. This is an EOTRH. So you can see that it looks like something has gnawed on the inside of these teeth, and that is the immune system attacking. You can also see that there's sort of a bulge on the side of this tooth here, and that is the hypercementosis. But for many of these horses, the first thing we need to do is shoot radiographs and establish how bad is this and how many teeth are affected. Like, what are we looking at in terms of the process? And then, oops, don't read that. And then what we're going to do is take out all the teeth. And you're probably at home in Facebook or YouTube land having the same reaction as everybody has when I say that we're going to take out all the teeth, and they are horrified. Nope, we are not going to do this. And when I say take out all the teeth, I do mean only the incisors, because luckily for horses, only the incisors are affected. In humans and cats, all the teeth are affected. And when I say take out all the teeth, you do take them all out on those guys. On horses, we're going to take out all the incisors. The good news is that the horses handle this really, really well. They are much, much, much happier when we're done. And the number one comment we get is, my horse is back to their younger self. I didn't realize that they had chronic low-level pain because they're really good at hiding it. And when we take the teeth out, we get rid of the pain, and the horses are back to 10 years younger. So we do blocks, and then we do this as a standing procedure. And the only side effect we really have long-term is that their tongue sticks out because they don't have any teeth to hold it in. So if you have a horse over 15, this is one of the biggest things we're looking at when we part the lips and start that dental exam at the very beginning. And if you have any doubts, one of the big things you can do is offer your horse a carrot to bite. If they have trouble biting into a carrot, chances are good they have EOTRH. So the moral of the story is that regular dental care with sedation, a speculum, and a bright light lead to happier teeth, happier horses, and happier owners. And that is all you ever wanted to know about teeth. Actually, there's a whole lot more, but this is the 101 view. All right.
Questions? On the EOTRH horse, are there any circumstances where you wouldn't take out all of the incisors if radiographs don't show that all the teeth are affected?
On the EOTRH horses, are there any times that we wouldn't take out all the incisors? I debate back and forth on this on a regular basis with myself. So most of the time, we do go ahead and take out all the teeth. And the reason I say that is because if radiographically we see that one or two sets, it usually comes in pairs, so like the outside corner, then the next one over. If we see that they're affected, there is a nearly 100% chance that at some point, all of them will be affected. If we just go ahead and take them all out, that is only one surgery, one recovery, you know, one whole shebang that the horse has to go through versus having to do it now and do it again in 6 months and do it again in 6 months. With modern diets, honestly, these horses don't need these teeth and they do really well without them.
Ask for any more questions.
All right, do we have any more questions out there in Facebook land? And if we don't get to them now, you can drop them down below and we'll do our best to answer them in the future. YouTubers can also do the same. All right. Thank you guys. Have a great night.